right, welcome. What will happen is I'm going to leave this video so it can be referenced to. Welcome everyone to my Q&A session, question and answer session. All right. Due to the nature of what I do, I always receive lots of questions, and some of them are similar. So what I've decided to do is just to come live and share answers to some questions. Some are kind of like controversial, meaning that we have different responses to a particular question. So due to my experience and expertise, I want to shed light on that controversial question. So let me see. Let me pull my screen, and I hope you guys can still see me. So the first question that I want to address today is I'm gonna skip the first one. I'm gonna go back to that. But let me address the most controversial question. Somebody said, I am not clear. Do I need a provider to get the CLIA waiver? That's one question. I am not sure. I'm not clear. Do I need a provider to get a CLIA waiver? Another question, which is very similar to that question, is how do I get a provider to collaborate with? Okay, so do I need a CLIA? Okay, so I am not sure. Do I need a provider to get a CLIA waiver? The answer is yes, and the answer is no. When it comes to CLIA certification, it depends on your state. Every state's regulation is different. That is why we have so many different answers. And when people are helping you answer this question, they give you different answers. And that is because everybody's experience is different from the other. So when it comes to CLIA certification, you have to go to your state and narrow down your search to get your answer. I'm gonna, for example, we have so many states. I'm gonna start with my state, Maryland. I reside in Maryland. And the answer is yes. When you want to apply for CLIA certification in Maryland, you do need a provider. We are actually from a very big group, the CLIA big group, and when you go to that group, you're going to see these questions over and over, and people are kind of confused. If you have your CLIA certification, good for you. But I purposely want to target this question because it's a controversial question, and a lot of people have different answers. So the answer is you do not, and you do need, based on your state. So to help you, just go to your state and narrow your search and ask question, and there is always a number for each state rep. You can call your state and ask that question specifically. Now what I've come to realize is that 9 out of 10 times you can be your own director, because there is a question on that application asking if you are the director of your lab. You can be your director. Due to the nature of what CLIA is, some states require that you have a provider, because when it comes to prescription, that's where orders, like standing orders, you need a doctor. If you're not a clinical person, you cannot place an order for some of these tests. So that's why it becomes controversial, because some states do require and some states don't require. So when you're doing CLIA waiver testing, meaning the test that falls under waiver, such as COVID, strep, HIV, manufacturer test, any test that you can do right there and give the results or find the answer, it's considered waiver. Meaning, for example, if you can do a COVID test in your house. You don't need to go to it. You don't need to go to a doctor, or you don't need to send your specimen to a lab for processing. That's point of care. Point of care right there. You can have answers to your testing. You can either determine if it is positive or negative. So that's why some tests do require standing order. But for the purposes of this group and what we similarly do together, you can be your own lab provider. I don't want to take too much time because I have so many questions. I hope this helps solve the puzzle. If you're here and you know and you have this and you're listening to me, if you find somebody asks this question, the best answer to give to that person is go to your state website and find the answer. I've helped a lot of individuals apply for their CLIA in different states. Some do not require. For example, New Jersey, Texas, you don't need a provider. You can be your own clinical director. But for my states, you do have to have a director, and they require that director's certification, their licensure, everything you have to. It's a packet. So let me help you again narrow the search. Any state CLIA application that requires a supplemental application, meaning if you're doing the CMS 116 application and you also have a state application, 9 out of 10 times you will be requiring a doctor, because that state application that is a supplemental one to the CMS 116, it is asking you to provide more details because you have to have a standing order when you're doing tests. COVID is coming back, guys. I'm beginning to see procurement biddings or whatever those things name is for COVID. In my state, we there is a bidding, there is a, how is it, procurement? I think you guys know what I'm saying, for COVID testing sites. My state is looking for sites that can be testing site that can do testing, that can administer vaccination, and that can do treatment. So if we have those capacity, we will be qualified as a testing site because COVID is beginning to pick up again. So if you don't have your CLIA certification, this is a good time to jump on the wagon to get your certification, because you are going to be able to do COVID testing. It's season, it's flu season, and everybody's beginning, the numbers is beginning to rise. So I don't want to waste too much time, but for CLIA, when it comes to CLIA certification, go to your state website. Do not rely on people because our experiences are different. I have people that in Texas, they don't need nobody to be their director. And again, I see people also comes when it comes to collaborating. Okay, let me go back to let me just go to the questions. Another question that I also want to address is, how do I get a provider to collaborate with? People ask these questions because they need to partner. So when your answer is yes, even sometimes you don't need a provider for your CLIA certification, but once you begin to add services, like for example, we have a lot of phlebotomists who are doing mobile services. They need doctor, especially when you want to set up your account with Quest. You need a physician to do house call for you. That would be one of the questions that Quest will ask you if you have a provider when you want to set up your account. So sometimes the answer is, if you need to set up your clinical account, you don't need no provider for toxicology, which is the drug testing, because by default, when you want to set up a toxicology account, you have an MRO that you can choose from the list. But when it comes to clinical, which is blood draws, you would need a provider. So that is why when you want to draw blood, you can't just draw blood. What are you drawing blood for? You're drawing blood for something. A provider needs to see the analysis of the blood. That is why they write a prescription. Each test differs. Like a provider may want to know if this baby is allergic to something. So they will write a prescription draw for allergy testing. That is why always when it comes to clinical, that is why it is termed clinical. You need a clinical provider. So that's why sometimes a lot of people need a collaborator, because most of us are not doctors. We're not clinical doctors, all right? So we need to collaborate with someone that can work with us, that can provide us with clinical prescription. So if you do not have a provider, it is okay. When you have a call for blood draw, the first question is, do you have a doctor's order? And you can still take them. Some clients have a provider. They have a doctor's order. The reason why you want to have your home provider is because it allows expansion. That means you don't have to rely on anybody. You can carry out those services on your home, and that's more money for you and your business. Because why there is a need for a provider. Why there is a need for providers, because if those tests comes back negative, or if those tests needs to be addressed, a doctor needs to see the client. And that's where we get into the other question of telecommunication, telehealth. So your doctor by default is, by regulation, needs to consult and see the doctor. If you test for someone for STI and it comes back positive, who is going to treat them? Somebody needs to treat that person, all right? So that's where you need a doctor to treat, meaning they need to just go ahead and write a prescriptive order to cure that disease. You have to think from the perspective that you're also treating. You are in a health system. You're not just a lab. You're not just testing. You're not just collecting. Sometimes all of these services are interwoven. They're all interrelated. So it depends on how you want to run your show. It just depends on what you want to do. My next plan of action in my business is to become a vaccination provider. I want to now vaccinate people. That's what we call expansion of services. And we are allowed to do that because we have our CLIA certification. That's the way that I want you all to think. There are so many things that you can do with CLIA, with drug testing. It's an health field. Everybody always needs something. And when you look at it, anytime that you want to go see a doctor, well, not 100%, but 9 out of 10 times when you see a doctor, before a doctor can diagnose you, they need to see what's up in your body. And how can they see? They need to test your blood. They need to do some runs and some blood work, some lab work. So I hope I'm helping you understand how to also run your show. It's not just about people are in this business. What are they doing? It depends on how you want to run your show, what you want to do for your own business. So let me go back to my other questions. There are so many of them, but I'm just fine tuning them to majority of people's need. Okay. Somebody asks, how are you submitting Medicare claims? I have that in my group. How are you submitting Medicare claim? If you want to be a Medicare provider, if you want to accept Medicaid or Medicare, that means you have to be able to be credentialed. You have to be set up to accept that Medicare. That's the first thing. If you're credentialed, you then know what you're doing. That means you have a biller that can help you submit claims. You need to be able to submit claims in order to bill Medicare, and you have to be credentialed. So sometimes the credentialing process is so long and it's kind of like hectic. So you have to hire someone like a biller to help you with the process. So it's so simple. Do not always complicate things that are simple, guys. Medicare, when it comes to Medicare, when it comes to insurances, it just comes with you being credentialed, meaning that you're affiliated with that insurance. That means you can accept that insurance. You've applied and you've been accepted. Your application has been approved, so you can start accepting that insurance, meaning that you're not going to be billing out of network. You're going to be billing in network, and that way when you submit claims, it just goes through. It goes through. So I hope I've been able to help you with this question. And if you want to do that, the first step is for you to be credentialed, meaning you have to submit application through the Medicare system. You need your NPI, you need all of those good stuff, which a biller should help you if you hire one. And to get a biller is just so cheap. There are so many people. I have one in the group I already tagged. What is her name? My very good friend. She's in that group. Tamika Duncan does billing, and that also comes with CPT codes. Like, you do need a code. What are you billing for? For example, COVID testing, if you want to bill Medicare, is 86 something. You do need a code. You're not a biller, so you don't need to worry about that. Give the job to someone that can do it, that is an expertise in that. So that's how you submit. And how do you submit? Another how could be the system, an EHR platform. You need an EHR, electronic health record system, to submit, because you do need to, of course, Medicare want to know when you did that, when you saw that patient, what is the date of services, what is their diagnosis, why are you seeing them? You're right. So all of those things comes in the responsibility of a biller that will help you. So you can use CLIA or OfficialCoachEli, which is PracticeMate, to submit your claims. All right, that's an EHR platform. It's also interwoven to COVID vaccination. When you do want to start doing COVID vaccination, you need an EHR platform system to do all of those things. That's where billing comes in, and it's a complex system to navigate. So a lot of people just shy away from that and just do private client, like, out of pocket services. All right, so I hope I've been able to help you understand. How do you add telehealth to your business for COVID testing? Let me tell you, this is so easy, and you have to help me understand what you're trying to do. Well, okay, that you already did that. You said called COVID testing. Beautiful question. You don't need to be a doctor to do telehealth. You just have to make it simple. What is tele? Television. Tele means tele. Telehealth, meaning you're behind the screen and you're performing health services. So what I do, let me help you break it down some. What I do is I help my clients and I help myself. I don't want no line in my when some people have COVID testing kits at home, right? The rapid tests, they have it. It's free. So I have that marketing, I have that services added to my thing. If you have a COVID testing kit at home and you need a COVID test, we can do a televisit. All they need to do is stay at home and I'm in my office, wherever I want to be, and watch them do the COVID testing, and I give them the results. If you have an EHR system, that's where that comes back again, EHR, right? If you have that EHR system, once you process all of their pre-registration, once you finish your services, you can automate all its automatic system and send them the results. And a system that is free that allows you to do that is Simple Reports for COVID testing alone. Simple Reports will help you give COVID testing results free. You don't have to pay for that system. All right, so if you need, I hope I've been able to help that answer that question. That question is simply, again, let me reemphasize, let me narrow it down some for you to make it interesting for you. Remember that you're buying COVID testing kits. When it comes to rapid, that's on you. You're buying it. There is no lab that is giving you those testings for free. Those kits is for you. You're gonna have to pay for that. That's why I always encourage people to get paid for that rapid test. Don't build no insurance, because listen, insurance is gonna be either 3 months time. You're pending your money. You buy a test kit for $5. You can sell that COVID test for $60. The extra is your own money, right? So, and why I invented the idea of telehealth for COVID testing is because it's gonna eliminate the cost of kits. You don't have to buy. All right, you're gonna let the patient stay home and use their home kits, and they're gonna be happy about that, because it's gonna save them time of gas and everything coming down to your office and avoiding lines and what have you. And when you're gonna have to set that system up where once they sign up for when it's signing or book telehealth visit for COVID, you're gonna send them the link. All right, after you know that you already have that test that services coming up, that appointment coming up, you send them the link so they can join you at a certain time that you've set up. And once they come in on this live that I'm doing, you just go ahead and ask them simple basic questions that you would, just typical things that you would do in the office. Ask them for the question, your name and everything, pre-register them. And when it comes to testing, then that's why Simple Report is a good system for COVID testing. There is a timer where you can just click and your test time starts. And you ask the patient, you just give them instructions while you're on tele. All right, and once the test is done, whatever the answer is, if it's negative, it is positive, you just check that and their result automatically gets sent to them. That's how that works. And I encourage a lot of us, if you're doing COVID testing, to do that right now, because you're gonna save money. You don't have to buy no COVID testing kits, and you still get paid for the services. What you do have to do though is you would have to go in your administrative system to add the COVID testing kits that they want to use. You just have to make sure you include that disclaimer that the COVID test that they want to use at home should be an FDA approved COVID test, because there are some testing kits that have been discontinued by CDC or that is not on the list. So you have to make sure that it is COVID, it is CDC recommended, it is FDA approved, and you will see it on that list. All right, and 9 out of 10 times, again guys, the pink COVID test kits is part of the ones that are on the list, so it's approved. The ones that they usually send in the mail from USPS, it's part of the ones that FDA approves. All right, so Do I need, the next question that I usually always get a lot of times, because people, they say CLIA, everybody's doing CLIA, everybody's doing COVID test, so they don't, people do not understand. So the question is, do I need CLIA to do drug testing? You do not need CLIA to do drug testing. The answer is no. Although drug testing comes with the ideology of you're collecting urine, right? People misconstrue that concept because when you want to do STI, when you want to do some kind of like analysis, you use urine, right? So people confuse this drug testing because they are collecting urine. But the answer is no. Reason that the answer is no is because you're only collecting urine for drug testing. You're not performing anything, so you do not need CLIA. CLIA simply is giving you the legal binding to do testing in-house. So because you're doing drug testing, you do not need CLIA. You don't need CLIA because all you're just doing is collecting specimen, splitting specimen, and sending it off to the lab. Your MRO and those lab technicians will take care of the rest. You are just a collector. And that's why the first step for you to become a drug testing agency is for you to become a collector. And that is the course that I teach. I hope everything is making sense for those that have these questions. All right? So the answer is no, because drug testing is just collection. Anything that you collect. And that's why even sometimes you don't even need CLIA to do COVID testing. Because the PCR testing, if you're set up with the right lab, they will set you up in such a way that they have their own doctors that can do standing orders. For example, Bridge Diagnostics have their own doctors that does the approval. And once you're in the system, you will see. Once you collect, when you start, because Bridge Diagnostic will also pay you per collection. So anything that you're just collecting, that you're sending off to the lab, you don't need nothing for that. You can actually do it. You don't need no certification, nothing, because you're just collecting and you're leaving. You're just dropping it off. Such as PCR testing, except if you're doing your PCR testing in-house. And that's where the benefits of CLIA comes in, because a lot of times you want to keep all your money in-house. You just don't want to be paid for just $20. You want to take the money, you want to get the money for both collection and testing. And that's where you need to invest in machines that can run the test. And CLIA certification will allow you have those things. So again, it boils down into the fact that how you want to run your lab. How do you want to run your show, or how do you want to run your business? Don't follow the crowd. Follow what you can do. Do research on your own. What works for you does not mean it's going to work for the other person. But it's good that you guys are asking very good questions. Software, I did mention OfficialCoachEli, Karaoke, Bamboo. Even you don't even need a software. Sometimes if you don't want to go fancy, you can use your Excel spreadsheets. It's just intense, but it's doable. Of course, another question is about policies and procedure. You need policies and procedure when it comes to CLIA, because everything is COVID CLIA certification is a regulated system. So you need to have policies and procedure. Anything that is regulated by the states, you need policies and procedure. You need to know how to do those things, and that's what policies and procedure means. What is the policy? What is your call? How do you do these things when this thing is this? That's what policies mean. So what is the procedure of doing those things? So anything that does with regulation, such as CLIA, is regulated. You can't just do anything that you want because you're dealing with people, human specimen and what have you. So you need policies and procedure to guide you. And when you have that policies and procedure, it's not just because you have to master and understand what the policies and the procedure is talking about. And so is applicable to lab manual. You need a manual as well to help you understand the drug testing business, because a lot of times TPA confuses people. What is TPA? Let me see if I actually have that question down here. I'm getting to that question in a minute. So TPA is a third-party administrator. When you are in the drug testing business, TPA could mean anything, but not to confuse you guys, TPA is simply a third-party administrator / consortium. if you're in the drug testing business, you need to enroll in a consortium, because drug testing, when it comes to DOT, Department of Transportation, that regulates the drug testing, there has to be a reporting of results. When results comes back positive, they need to be reported in the clearinghouse portal, because such driver that is testing positive for drugs should not be on the road behind the wheels. That comes with safety and what have you. So how do you go about those things? That's where the TPA consortium comes in place. And I think I have a question that has to do with TPA samples agreement. When you are, this question is for my new clients. It's not my clients, but it's in the group. I actually posted an agreement today in the group, and I see a question underneath that question asking if this is for the TPA. Do not always make things complicated. When you are a TPA, when you are signed up into a consortium, whoever is signing you in that consortium is going to give you an agreement to sign. You don't need to provide an agreement when you are collecting for somebody. Such as FormFax will send you their agreement. You're going to sign. FormFax will have their agreement sent to you. So don't worry about that agreement. eScreen will send you an agreement. All of the TPAs will send you an agreement. On the other end, if you want to run a consortium, if you want to help truck drivers in their consortium, you want to tell them, hey, don't worry about it, I got this, I'm going to help you with your random, because they are required to have a random testing. So if you want to have that system in place, you do need an agreement. And an agreement is simply the same concept. When you are signing up to do something for somebody, they send you an agreement. It's just legal binding something. Whatever you want to be in that agreement is what you want. All right? So that's the legal. So that's the same agreement. So if you want to have a consortium, the answer is yes. You would need to provide an agreement for the trucking agency that you want to help. You'll need to sign an agreement. What's in agreement determines on what you want to do for that people, for that agency. If you want to help them with their random system, if you're going to be the one to report to clearinghouse when there is a positive result, all of those things. And that's a separate training. That's a separate word on its own. Consortium TPA. And that's where my lady comes in place. That's where, what is my beautiful lady's name? Shauna Hunter. That's where Shauna comes in place. She's an expertise when it comes to consortium. She's gonna help you with your consortium agency, because that's a total, it's all interwoven. You can see how everything is interwoven, but then do not confuse that. So if you're looking for an agreement, it's simply, you can use what you have to fine tune it to what you need. There are just similar terminologies. So again, let's always get in the habit of not making things complicated for ourselves. That's simply that. If you want to own your own consortium, you need an agreement to present to the trucking agency. If you're gonna collect for a TPA, which we already have their own consortium, then they will send you an agreement. Because remember, people have consortium and they have clients in your state. So you're saying you're offering drug testing, right? So they partner with you to help them carry out all of those drug testing in that state, because their client is in your state. So they will send you an agreement for you both to sign. So if you have a consortium and you have a client in their state, you're going to send an agreement for them to sign. It's a business agreement. It's not, don't make it complicated. I hope I'm making sense. So that's that answer to that. So many things that you guys can do. We have Bridge, Altalab for those that want to do out of pocket. Altalab is a lab that will send you clients. They're not gonna send you client, actually. Let's be more serious and be more honest. You're just gonna be listed on that platform. So anyone looking for services, you're gonna be on that list, and they can choose you. It's not guaranteed. Clients may not choose you. And it's the same thing as FormFax. It's the same thing as e-screen. They're not, if you are just gonna be on the list. FormFast is a marketplace. You're just gonna be, you have an agreement to be a provider, and you will be on that list. And while you're shopping, while they're shopping, if they find you on your services and your fees attractive and reasonable, then they contact you. But is it by guarantee that when you're on that list, when you sign that agreement, they're gonna send people? No, that's not what you have to read your agreement. That's not what the agreement is saying. The agreement is just saying that we want to work with you. You're on that list, and a provider or someone needing your services can find you. That's what that is. That's what that is. I hope it's making sense. If anyone have questions, please drop them while I'm here and while I'm still answering questions. Let me see if I have any question. I still have about 3 more to go, just so I can save time. Right. Oh, you need an SOP. Yes. Always do your research. Absolutely. Simple report. Hey, Liz, Tamika Duncan. What's up? What's up? What's up? You do not need, let me tell you, when you, that's where collaborating physician comes in. Doc Queen McKean, I'm just saying your question. You can provide, if you have a doctor that is already on your team, just use their name to submit your vaccination application, because you do need to have, it's clinical again, so you need to have a provider on board when you're submitting an application to be a vaccination provider. But who administer that, it could be anybody, not anybody, but like, yeah, you could be a hiring or an LPN to administer. It's just a shot. Even an MA can administer COVID vaccine. But when meaning that you have a supervisor that can supervise all of the services, so somebody that is clinical needs to be on your application. And it's the same concept for COVID and CLIA. They want to know, do you have a provider? Some state care and some state don't care. That's why CLIA regulation is different by states. All right, then drop those questions while I'm still here. I'm ready to answer all of them. So Tamika Duncan, what is SOP? Can you drop what that is? I don't know what that is. I don't know. So another question is, how do you go about finding a director? So at the end of the day, if you do realize that you want to do more, you want to do COVID, you want to do vaccination, you want to do flu, you want to do so many things, and you want to have a clinical account request because you need a director, how do you find that? I have a program called the CPNP program, the Collaborating Physician Network program, where I help you navigate the system. You're not going to be alone. You're going to enroll in that program, and I can help you, connect you with a provider in all states. I have a recent client in Nevada, and we are just, with under 3 days, we were able to find providers. I have that system in place. So if you need to have a provider, if you're looking to collaborate with some director, I can help you. But on your CLIA application, you can be your own director. Don't let that confuse you. But if it comes to order and everything, you need a doctor for your house and what have you, and you need a doctor, let me know. Another question that I want to address is, I am a mobile phlebotomy lab. Do I need CLIA for the state of Florida, or how do I find out? Just by Googling, go to the Department of Florida website, and you're going to see the answer right there. You would rather come to Facebook to ask the question instead of you to same energy, drop it on Google. Google will help you narrow down your search, and you will find the answer. So, again, mobile phlebotomy, you do not need CLIA to do mobile phlebotomy, because you're working with a doctor and you're working with a prescription. But if you do want to submit those order for a lab to a lab, you will probably need a doctor, because they would want to ask you, where is this order coming from? Insurance, setting up contracts, location. Insurance, again, the best insurance that I recommend is CMF, because CMF is a healthcare system, and you are in the healthcare field. So CMF is a very good insurance that you can obtain, and they have professional and general liability, work comp, all of those good stuff, and very affordable. Setting up, if you need mentorship, that's where we come in place to help you set up with your thing. Contract, again, I've done this training before. Canva, is it Canva? Jotform has contracts, a lot of contract that you can fine tune to your need. And if you want specific contract for specific projects, we also have that. When it comes to location, though, because a lot of people, and location is actually critical when it comes to this business because of drug testing. You have to be careful when you're choosing your location if you eventually will want to add drug testing into what you do, because drug testing is DOT regulated, right? So you need to have a specific bathroom requirements. So that's why when you're looking for location, be very careful, so that when you eventually decide to do drug testing, your bathroom requirements comes in place. So yes, location is critical when it comes to this business. Even for, regardless of drug testing, you want people to be able to see you. You want to be on the, at a very good locative place where people can locate and easily tell that, oh, there is COVID testing here, we can come. It's gonna reduce the energy that you're gonna channel into your marketing. I was getting ready to say something, but yes, location is critical, and we have on-site services, we have mobile services, we have tele services. There are so many ways that you can lay out your services or your business, however you want to go about it. Let me see if Tamika has dropped down. Yes, we have a lot of people that are actually administering vaccine right now. And that's the way. Testing is not only the thing that this government people want to do right now. They actually want to do vaccination. So if you're interested in vaccination or into COVID, you should consider vaccination because it's now the new thing, you know, because it's not just testing. People, when you test, what do you do with them? So they actually want you to have the combo package, which is testing, vaccination, and treatment. Now there is a treatment for COVID. Standing operating procedure, absolutely. Standard operating, yeah. Do you have an MD for director? It depends, absolutely. My state, Maryland, requires that you have a doctor. You cannot submit that application if you don't have a doctor, and it's not applicable in Texas. But my states, and that's how I actually am on the leverage on the better side, because by default I have to work with a doctor. So that's working with a doctor gives me lots of opportunity. I can decide to do vaccine, I can decide to do flu, I can decide to do clinical, because I already have a doctor on board that is working with me. So even if your state does not require, it is in your best interest to actually find a doctor because it allows you to do more. All right, it allows you to do more. Let me go back to my question board. Exactly. See, Tamika dropped. Chicago requires a MD. Yeah, just have to say. But be careful. MD meaning a provider. It could be a nurse practitioner. It could be a doctor. For example, Philadelphia, Pennsylvania requires a provider, and that provider can actually be a PhD holder. It could be a nurse practitioner. It could be a DOC, and it could be an MD. As long as they have the capacity to do research or do clinicals, then it's acceptable. COVID vax, DNA. So there are some also services that you can also have. You can do drug testing if you want to. You can do DNA testing. You can do strep flu season is right here. You can do flu, you can do HIV, you can do pregnancy tests, you can do cholesterol, you can do AB1C. That's the variation of tests that you can add to your services. What is this? It's about time to go now. So MRO versus collaborating physician. MRO versus collaborating physician. We have a lot of people always confuses who an MRO is. When you have a toxicology account, I'm typing CLIA. CLIA is on my mind. I'm about to type local. So when you have a toxicology account, excuse me guys. When you have a toxicology account, you need an MRO. You need an MRO when it comes to a toxicology account. So, meaning that's your drug testing account. An MRO is on is a medical review officer that reviews all your drug testing. So you don't need a provider for drug testing. An MRO will do that, and the lab does it in a way that when you're setting an account up with them, they do not. It's not an ASO thing. They will provide you with a list actually, and you can just pick an MRO from the list, which makes it more easy. And that's why drug testing is actually very sweet, because the money, the business is there, the process is simple, you know, the training, the setup, everything is so easy. For CLIA, it's a little bit more complex because of the clinical constraint. And if you're not a nurse practitioner, it's, well, like people like us, a lot of us, we are struggling because CLIA deals with more clinical things. So you always probably would, 8 out of 10 times, would need to collaborate with somebody. So again, I think that's a wrap from here. Let me see if I have questions beneath. Otherwise, I hope I've been able to help you guys. Wow, look. Did you guys just see what Tamika said? She said Chicago specifically states a MD. That's why you're gonna know that there are some states. Imagine that. And the same thing that you're doing, some states like Texas don't even require nothing. And someone like Chicago, a state like Chicago, is saying, I don't even want an MP. I don't even want a DOC. I don't even want a PhD. I want a doctor. That means you ain't gonna be able to do CLIA, because your doctor is gonna be taking all your profit. A medical doctor, they be cheesy. They don't want to help. Like they want to help, but like medical doctor, you know what I'm talking about. So again, so that's it. Just always go to your states and find answers. Go to the website and find answers. Don't rely on people's answer, because the answer varies. The answer varies. I love you guys so much. Honestly, when I say I love you all, I mean it from the depth of my heart, because you guys allow me to do what I like to do, which is sharing impacting knowledge. And that's where my name comes from. I am the CEO and director of Impact Diagnostic Lab and Health Services. I love impacting lives. I love making a difference and helping. And I hope this has been able to help you navigate the system some. And with that, bye from here. Love you, and I'll see you on the other side. Take care.